What are UTIs and kidney infections? The urinary tract is actually made up of several parts, which includes the kidneys, bladder, and urethra. When some bacteria infect your urinary tract, it's called a urinary tract infection. The most common type of UTI is the infection of the bladder, but urethra infections are also common. Much like these infections, a kidney infection is also a UTI. However, kidney infections are quite serious and can lead to more complications. That's why it's important to know when a UTI is actually a kidney infection. These two things have a lot of symptoms in common. Both of them can cause the following symptoms: a burning sensation while urinating, feeling like you need to urinate often, urine that smells bad, cloudy urine or urine with blood, abdominal discomfort, and only urinating a small amount even though you feel like you need to urinate a lot. If your infection has moved towards the kidneys, then you might also feel fever, chills, pain in the lower back or side, and even vomiting. Usually, your urinary tract is well equipped enough to prevent any sort of infections from occurring, since it flushes out any pathogens. But when bacteria manage to make their way into the urinary tract and start to multiply, that's when things get bad. A lot of the time, bacteria travels from the gastrointestinal tract and makes their way into the urinary tract. Women are more likely to get UTIs than men because of their anatomy and the path by which bacteria travels. Unfortunately, when these UTIs travel upwards into the kidneys and are left untreated, it can lead to sepsis. In short, kidney infections are generally the outcome of a less severe UTI that was left untreated. Usually, UTIs are analyzed by a urine sample. If there's any sign of bacteria, blood, or pus, then you'll get prescribed a course of antibiotics. The type of antibiotic depends on your infection. Your doctor might also prescribe you medication that helps relieve the pain, and those who have had severe kidney infections might need to spend a few days at the hospital. They might also need to receive antibiotics and fluids through an IV. Luckily, you'll feel better in just a few days after antibiotics, but do not skip your meds just because you think you're better. That's because without the full course, the stronger bacteria might not get killed and flare up again. If you're dealing with a UTI, you should take extra care of all the fluids you drink. Make sure to stay hydrated so you can speed up the healing and flush out the bacteria from the urinary tract. If the pain gets too much to handle, a heating pad can also help ease back pain. Avoid both coffee and alcohol, which are dehydrates and make you urinate more than usual. If you feel like you have pain while urinating or any similar symptoms, go to a doctor.